So this is just a final rounding off session. We hope you've really enjoyed the day. And this is just to help you think about what happens next, and in particular, how the Research Support Service can help you with that. So firstly, why might you want to use the Research Support Service? And I hope what we aim to do is give you tailored support that meets your specific needs. So obviously, all we've been able to do today is do something that's rather more generic. Hopefully it's been useful and it's given you some general pointers, but you might feel you need a bit more. There were loads of really specific questions today that we couldn't get round to, but we would love to talk to you individually and be able to go through some of those finer details about your particular circumstances, what it is that you're trying to do, what your research is all about. And that's what we hope, if you approach us, we can have some of those conversations with you. So obviously we can talk to you about the whole range of fellowship, all of the schemes and which one might be appropriate for you. The kinds of things that we can offer is that we do have methodological expertise, so that's statisticians, health economists, qualitative researchers, and you've already heard quite a lot in the people and communities talk about the kind of support that we can give you for patient and public involvement. We can also signpost you to other groups for support, and just in our breakout group, we were mentioning the Research Delivery Network, but all sorts of other groups that might help you along the way and that you might in fact need in order to put in your successful application. So, and the kinds of thing we offer is, perhaps towards the end when you're nearly ready to submit, we can actually look over your application and give it a bit of a review, and some final pointers to really polish it up. We can also, we've talked about interviews, and we can help you prepare for an interview if you are shortlisted. And we can also just talk to you at a much earlier stage when you're really developing what your research might look like. And we can help you think about the skills that you've got now and the skills that you want to develop, and what kind of training you might need, and what looks like a sort of really convincing training program. So hopefully all of that is of interest to you. So just to say again, as I mentioned this morning, we're a service that's made up of 8 different hubs. So we happen to come from the University of Southampton and partners putting on this event today, but you are welcome to go to any of the hubs that you think suits you. So that's entirely up to you, and all of us can offer you support with your fellowship application. And all of our hubs will broadly support you. The exact mechanism by which they do it may be slightly different, but essentially you will all get a very similar support for your fellowship application. And all of us are made up of people who are researchers in our own right. We come from quite a wide variety of collaborators and different research groups. So all of us have a really broad breadth of expertise that we can offer to you. And as I mentioned this morning, there are also these specialist groups who can help particularly with public health research, social care research, and potentially there is a group who focus on mental health research, and that is the group coming out of King's College London. So as I've said, we can help you at a variety of stages, from really early when you're just thinking about your fellowship application, all the way through to right at the end when perhaps you're looking to prepare for an interview. And along the way, we can help you think about refining your research questions, what it is you really want to do, and whether that is possible and a deliverable research project within your fellowship. We can help you think about the supervisors you need if you don't have them already, and what kind of input that you need in terms of expertise to help you once your fellowship gets going. We can help you think about writing. How do you write about yourself? How do you write about your project? How do you make sure it's really clear and persuasive for reviewers? We've talked about patient and public involvement. We can also help you think about issues of EDI, equality, diversity and inclusion, and how you make sure that your research is really inclusive. We can think about the methodology, as we've mentioned, and right at the end, we can also think about how you're going to demonstrate impact and how are you going to make sure that you have planned that in for your fellowship. So for all of these, the best way to get hold of us is to go onto our website and request support there. We do suggest you come as early as possible. Certainly in our breakout group, one of the successful applicants said that he had been working on his application for at least a year. So these are it's a long process. It needs a lot of preparation. So we also suggest you come to us early and we can help you along the way. So I'm just going to leave you with the contact details and how you get hold of us. It's a lot of work that we do with fellowship applicants, so we're really experienced. We know what good looks like. We've seen an awful lot of them in a variety of different sort of settings and all of the different levels of fellowship. So we're pretty experienced at seeing this stuff, and we'd love to share our expertise with you.